This is a supine chest radiograph of a young man following a motor vehicle collision. The film shows increased lucency at the left lung base, with an abnormally deep and sharp costophrenic angle extending more inferiorly than on the right side. There is no definite visceral pleural line visible on this view, and ECG leads are noted overlying the chest. In the context of trauma, this appearance is characteristic of a deep sulcus sign, indicating the presence of a pneumothorax in a patient imaged supine. When a patient is lying flat, free air within the pleural cavity tends to collect anteriorly and basally rather than apically, so the most obvious radiographic manifestation may be at the lung base. The increased lucency and deepened costophrenic angle represent air accumulating between the diaphragm and the lung base. The differential diagnosis includes a deep sulcus from a pneumothorax versus apparent asymmetry due to a contralateral pleural effusion. However, in this trauma setting, a left-sided pneumothorax is the most likely explanation. Follow-up upright radiograph and CT imaging confirm a small left pneumothorax. It's important to recognize this sign because it is often subtle and easily overlooked on supine trauma films, particularly in intubated or ventilated patients. In those on positive pressure ventilation, even a small pneumothorax can rapidly progress to a tension pneumothorax, so early recognition and communication with the clinical team are essential. Further evaluation can be done with an upright or decubitus film with the suspected side up to confirm the presence of pleural air. Management depends on the patient's clinical status. Observation for a small stable pneumothorax or insertion of a thoracostomy tube if the patient is symptomatic or at risk of progression. So overall, this film demonstrates the deep sulcus sign of a left-sided pneumothorax, a subtle but important indicator of pleural air on a supine trauma radiograph.